All right, we're going to talk about kidney labs. Where are your kidneys located?
In the corporal vertebral, the last.
And the CVA. Very good. Very good. Way up here on your back, right? Okay. They have several jobs, which we'll talk about in a bit. We know that they get rid of waste products, right?
Yeah.
They pee, obviously. They maintain your blood pressure through which system? RAS system. Okay. They synthesize vitamin D. What's vitamin D's job? How does it do bones? What is vitamin D's job? Vitamin D's job is it marries with calcium and allows your body to absorb calcium. Okay, so if you don't have vitamin D, you don't have calcium, and that's how you could get poor bone health. Okay. All right. So we're going to talk about what the kidneys do, what you should see in the urine, what is urine. We're going to start there. All right. So we're going to start with the BUN. BUN stands for, all right, and what is BUN? What is it? All right, BUN is a waste product that you're going to find in the blood. So when we talk about normal levels, which are 8 to 20, what's a normal BUN? 8 to 20. We draw that from the serum. That would be serum lab. So if you have a whole bunch of waste product in your blood, what does that tell me? That means your kidneys are not functioning because your kidney is supposed to get rid of 2 big waste products. It gets rid of a lot, but 2 big ones, BUN and creatinine. So if it's building up in the blood, that tells me your kidneys are not getting rid of those waste products. So there's obviously something wrong with your kidneys. What's a normal BUN? 8 to 20. BUN is a byproduct of protein breakdown. So we all have BUN in our blood. That's normal, right? Because we eat protein. Yeah?
Yes.
So as your body breaks down the protein, it produces BUN, sends it to your kidneys, and your kidneys, exactly. If your kidneys cannot excrete it and you're just eating normal amounts of protein, that BUN is going to start to increase in your blood because your kidneys can't get rid of it. Do we understand? Yes? Okay. If the BUN is greater than 20, what does that tell me? Something is wrong with the kidneys and we need to figure that out. It doesn't matter.
Oh.
Yeah. That probably, you see it low sometimes if people are like vegetarians or, they don't eat a lot of protein, so. All right. Creatinine. What's a normal creatinine level? What is it? All right, 0.8 to 1.2. This one is a byproduct of muscle breakdown. Now, we all have a degree of muscle breakdown as we go through the day. We lift things, we walk, we burn muscle, right? But we don't burn as much muscle as we do protein, correct? So which one's a better indicator of kidney function, BUN or creatinine? Do the other one. Creatinine, good, everyone, because we all have protein that we break down. So it would be normal for us to have BUN in our blood, right? Is anybody in here breaking down massive amounts of muscle on a daily basis? No. So if that one is elevated, that's a better indicator of kidney function because you don't have very much in your blood. Your kidneys should be able to get rid of that very easily. Yes? Okay. So if we get greater than 1.3, then that tells me something is wrong with your kidneys. You're not able to get rid of this normal amount of muscle breakdown that we all go through throughout the day. The only exception to that rule, okay, is if you'd had something happen in your body where your muscles broke down very quickly, like you had rhabdomyolysis or something. You might see the creatinine increase, but eventually that'll probably lead to kidney damage anyway, because your kidneys are having to try to excrete all those waste products. Are you with me?
Yeah.
What's a GFR without reading to me? What does it stand for? Glomerular filtration rate. What do we say the glomerulus was? The sliding glass door. So the filtration rate, what does that mean? How fast it's able to open and shut its doors and let things out and filter your urine. Okay. So the higher your GFR, what? The better your kidneys are doing because they're able to filter a lot more. Okay. This goes in mLs per minute. Okay. So a GFR greater than 125 is our ideal kidney function. GFR greater than 125. At less than 90, we're like, it's not good. Something is going on. At less than 25, those kidneys are failed. Okay. And at less than 15, you have to be on dialysis or you will simply pass away. Okay. Because your kidneys, you're going to build up in waste products and fluid and all kinds of stuff because they're not working at all. Do we understand? Okay. So the flow rate of filtered fluid through the kidney, that's what the GFR is. Do we understand? Now, it is important to note that there is an age-related decline in GFR. We know that people's kidneys get kind of crappy as they get older, right? I mean, they've been working for 70 years, okay? So around age 60 to 69, it'll be around 85, and we don't consider that altered. We have to look at the patient's age. Now, when you get the GFR back on a lab, you'll see it's got all this stuff on it. It accounts for things like age, sex, and race, because each race has a different rate at which they get rid of urine through the kidneys. Okay. So they will tell you what it is based on that patient's statistics and demographics. Got it? Okay. The next we're going to look at is a urinalysis. What is a urinalysis? But what is it? What is it? Okay, it is a urine dipstick. What are we doing? We are analyzing the components of the urine. We're looking to see what's supposed to be in there that's present and what's not supposed to be in there that's present. And that will give me an indication of what type of disease this patient has. Do we understand? Y'all know what the dipstick looks like? Okay, you can do it at the bedside at the hospital, or you can send it off to the lab. All right, so we're going to look at each of the things that you might see in a urinalysis. Okay, and then it'll just guide our decisions. A urinalysis is not diagnostic. We would need cultures or whatever it is, but this kind of gives us an indication of where we need to look if the patient has a kidney problem. Okay, got me? All right, so turn your papers over. If you saw glucosuria, what could that mean? All right, so they have sugar in the urine. So what disease could that be? Diabetes. But am I going to diagnose them with that because they have sugar in their? No. See, you say, oh, it's a screening tool. I just got to look. Now I would draw a hemoglobin A1C, insulin level, blood sugar. You see what I mean? So it's just guiding me. If the patient has bilirubin, their urine is brown and they have bilirubin. They have some kind of liver disease, like what? What's the most common that we would see that would have bili in the? Well, they probably are jaundice, but which liver condition causes hyperbilirubinemia? It's okay if you're wrong in here. They're wrong most of the time. That's why they're here, because it's first semester for them. You know, you're supposed to be wrong in this semester, right? I know I'm gonna get mad at y'all, but here we are. What were you gonna say? You don't have to be afraid of me. I've never hurt anyone. Cirrhosis is correct. We give you some good feedback. Okay, so cirrhosis is when they drink themselves into an oblivion and then their liver goes bad. Yes? All right. If the patient has protein in the urine, what does it look like? I swear to God, you have said this before. I know, but I think I went on to something else because y'all pissed me off and I was like, I don't know shit. Meh. Protein in the urine. No, she said thick, and I was like, I said, are you gonna drink it? But now. Nope, it's an appearance. Cloudy would be UTI. There's something, but it's floats on the top. Thank you. I know you've said that before. It is frothy. You'll see like a froth in it. That means that there is protein. Y'all need to be jotting some notes down because y'all don't know anything yet. Quite yet. No, don't turn your paper over. Right on the back. All right. If you see leukocytes in the urine, what could that mean? All right, that would be a UTI, urinary tract infection. Okay. If you got ketones in the urine, what could that mean? You could have DKA. It can also be a sign of either dehydration, like if you're severely vomiting, because ketones only come out when you have fat breakdown. If you've got glucose to use, your body will use glucose, and that's good, right? You burn glucose into ATP for energy. If it doesn't have any glucose that it can use, then it has to start breaking down your fat. The byproduct of fat breakdown is ketones. So if you're real dehydrated, or you've been puking, you don't have any glucose available, then you might see ketones in the urine, okay? Yeah, it's white blood cells, probably some kind of UTI. What about blood? If you saw hematuria, blood, what could that mean? Sometimes, okay, I can agree with that. Bladder cancer can do that. It's not very common, but I do agree with you. What's more common to have hematuria? No, VPs shouldn't have hematuria.
A Foley catheter?
Okay, if you put in a Foley catheter, sometimes we'll see some red blood cells, and they're just from the trauma.
It using action.
Jesus. Okay, so trauma, yes, but there's not a lot of people falling on their penis, so yeah. So you would see this maybe in some UTIs, okay, or if they have glomerular damage because something has burst through it and broke up those glass doors. Now you got glass all inside your kidney, right? Okay, so that can mean you have major kidney damage. What about nitrites? Anybody know what nitrites are? Y'all are killing me today. I'm like trying so hard not to laugh, but I'm having a good time. Are you having a good time? Great. Nitrites. Anybody know what these are? All right. So if Brianna, if you walked up here today and you on the porch before you got in here, you saw a big ass pile of cow poop. Okay, and you know cow poop is very large. You would know it wasn't a dog, right? But you look around and you don't see a cow. Do you still know one was there? Yes, that's what nitrite is. It's the poop of the bacteria. So even if I don't see bacteria in their urine, if I see nitrites, they pooped in here, so I know it's in here somewhere. So that's probably a UTI. Yeah, it's the poop of the bacteria. Yeah, because remember, bacteria are living, breathing things. They eat, they drink, they poop, they make waste products, and we can kill them. Yeah. Yeah, yes. Or it just maybe didn't show up in this urine because sometimes before people give a urine sample, they drink tons and tons of water and it can dilute their sample. So, you know. All right. What is a normal urine specific gravity? 1.010 to 1.025. Okay. So 1.010 to 1.025. Some sources will say 0.035. Okay. But what is the specific gravity of water? 1. So the farther away from water it is, the thicker, the more viscous, the grodier it is, the higher the specific gravity. So if somebody has a massive UTI, what do you think their urine specific gravity is going to be? It's going to be very with 0.40. It's going to be higher because it's going to have white blood cells and nitrite. They're going to be a little bit more dehydrated. Okay. If somebody has DI, what is their urine specific gravity going to look like? Like close to 1, right? Because they pee out straight water. Oh, no. Sleep. Okay. All right. What is the pH of urine usually? You don't have to give me a specific number, but what is it? What? Y'all know pee is acidic, yes? It's acid. Okay.
Yeah.
So remember we talked about acid-base balance. Your kidneys are responsible for getting rid of which thing? They do for electrolytes, but I'm talking about acid-base balance. You've got 2 systems in your body for acid-base balance. You've got your lungs. What are the 2 things that the lungs use to acid-base balance? What do your lungs do? What do your lungs bring in? Oxygen. Okay. So your lungs have oxygen and carbon dioxide, right? Oxygen is your base. Good. Nope. Yep. And CO2 is your acid. Woo, Lord. All right. In your kidneys, you've got bicarb, which is your base. And then you've got, what's your acid? Yeah. So a hydrogen is your acid. So usually your pee is very acidic, right? So it's going to be very acidic. All right. That's what we would see in a urinalysis. Going to kind of guide us to what tests we need to do next. Then we go to a urine culture. Okay. Urine culture. Now that cultures, remember, are the only definitive way that we can diagnose a UTI, right? Or cultures are the only definitive way that we can diagnose any type of bacteria. Okay. So we will send that off to the lab. Now you have to put a source on it as far as like how you collected it, because there's dirty ways to collect urine and there's very clean, sterile ways to collect urine, right? Now our urine is sterile when it's in the bladder, but once it hits the outside, there's skin cells and bacteria and a full microbiome from the vagina and there's hair. There's all kinds of stuff down there that can contaminate the specimen, right? What's the dirtiest way to catch urine? No, I mean like as far as how you can collect urine, what's the dirtiest one? But like how did I collect it? So a clean catch. A clean catch urine is the dirtiest way to catch urine. Of course it is. Because you've given this teeny tiny little washcloth and you're like, wash your privates, right? Okay. Okay. And they don't clean very well. People are dirty, y'all. People are very dirty. And they take that cup and their hands are touching the cup, right? They didn't wash their hand. And then they put it between their legs and it touches the outside. That is dirty. So the dirtiest way to catch urine is a clean catch. So we would require a lot of bacteria in the urine in order to say they have a UTI because there's normally bacteria living out there anyway. So turn over your papers just so you can see this really quick. Look down at the very bottom. Okay. where it says if it's positive for bacteria, if it's clean catch, you've got to have over 100,000 colony forming units per ml in order to say that you have a UTI. Okay. Now, if I cath the patient, isn't that supposed to be sterile? Yes. So that should be very clean, right? So I only need 50,000 bacteria in the specimen in order to say that they have a UTI. And then the most cleanest, most sterile is if I take a giant ass needle and put it directly into their bladder. That urine is sterile, right?
Yeah.
Okay. So that only requires a teeny tiny amount of bacteria, which is greater than 10,000. Do you understand? Huh? Yeah. You make it a tiny bit of blood, but why would I do that? But what is like, you've never seen that happen, right? So obviously we don't do it very often. So it'd only be because I cannot get urine the other way. So what patients can I wouldn't even be able to get a cath in. But if you have a catheter in, I could just get urine from the cath, right? Okay, so what patients can I not even get a catheter in? Huh? Okay. No, you can get a catheter in, baby. It's teeny tiny, but you can get it in there. You try to get it in and you're like, there's an obstruction. Can't do it. What were you going to say? Go ahead. Kidney stone? Maybe, but the urine usually can go around the kidney stone unless it's very large. What do you think? Yes, that's what I was looking for. If you have a very large prostate, remember the prostate wraps around the bladder neck and it squeezes it. So if I try to put a cath in that person, I'd be like, I can't even get it in. So we would have to go in suprapubic. Do you understand? All right. Do you understand the very basics of pee? Okay.